dentalexperience.in വെബ്സൈറ്റിലേക്ക് സ്വാഗതം. നിങ്ങൾ ദന്തചികിത്സയ്ക്കായി തയ്യാറെടുക്കുന്നുവെങ്കിൽ നല്ല തീരുമാനങ്ങൾക്കായി നിർബന്ധമായും ഈ വെബ്സൈറ്റ് സന്ദർശിക്കൂ.
Hi everyone, this is Dr. Olivia Bivera and today we are going to be speaking about pulpectomy. The most common treatment for a painful tooth in kids is pulpectomy. Now one might wonder what exactly is pulpectomy. When the inner portion of the tooth, that is the pulp, becomes infected, it leads to pain and sensitivity. Normally, in an adult patient, the treatment of choice is root canal. But whereas in kids, the treatment or the procedure is known as pulpectomy. Normally, pulpectomy involves the removal of the entire inner pulp to relieve the patient from pain. Now, what exactly is dental pulp? Every one of your child's tooth contains an inner core called as pulp, which is sensitive and the living part of the tooth. This pulp is soft and contains nerve endings and blood supply, which keeps the tooth alive and healthy. The main role of this pulp is to provide sensory function to the tooth, hence making it sensitive to hot and cold substances. The blood supply of the pulp also provides nutrition to the tooth. Now one might wonder who exactly requires pulpectomy. One of the most common reasons where a kid requires pulpectomy is when a cavity remains untreated for a long period of time. What happens is this untreated cavity leads to infection of the pulp. Sometimes decay also develops under an already filled restoration. This also leads to a kid needing pulpectomy. Once the infection reaches the pulp, a kid normally complains of pain and sensitivity. Now this sensitivity is mainly towards hot and cold foods and beverages. Another reason for needing this type of treatment is when your child sustains some kind of dental trauma or injury to the tooth, which leads to breakage or cracks in tooth. Normally, cracks or breaks doesn't warrant for a pulpectomy to be performed. But if this crack or break is so deep that it reaches the pulp, the kid will require pulpectomy. Since the pulp gets exposed to the external environment, the sensitivity of the tooth is increased, leading to pain and sometimes swelling. Pulpectomies are usually specific to kids' teeth because the roots in children's baby tooth are different than the adults. A pulpectomy is very important to relieve the pain associated with any kind of infection or dental trauma. Thus, it can also prevent complete extraction of a normal tooth. Thank you.
ഈ വീഡിയോയിൽ വിശദീകരിച്ച പ്രശ്നം നിങ്ങളുടെ സുഹൃത്തിന് ഷെയർ ചെയ്യൂ. ചികിത്സകളെപ്പറ്റി കൂടുതൽ അറിയാൻ ലിങ്കുകൾ ക്ലിക്ക് ചെയ്യുക.